Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. You hear that noise, that bub-bub, bub-bub, that heartbeat noise? Typically, you need a stethoscope to hear it, but imagine hearing your own heartbeat constantly every second of every day. You can't tune it out, you can't turn down the volume, and no one else can hear it. Today, we are meeting two women who lived with this maddening sound in their ears until they came here for a first-of-its-kind treatment. The condition is called pulsatile tinnitus. Pulsatile, as in your pulse. People report a whoosh or a swooshing noise. We'll hear how our guests describe it in just a few moments. And when that noise lasts for months and even years, it's no surprise that many patients say it's hard to concentrate, hard to sleep, and they end up oftentimes developing anxiety or even depression. Up until recently, there was no proven way to fix pulsatile tinnitus, but now a minimally invasive procedure can cure certain patients. Joining us here in studio is Dr. Koji Ebersol. He is the Director of Endovascular Neurosurgery here at the University of Kansas Health System. So instead of cutting into brains, kind of like your average run-of-the-mill neurosurgeon, he is often doing more delicate work involving the blood vessels of the brain. Always great to have you center stage here at the table with us to talk about this. We're also joined in the studio by Krista Bird, one of your patients who developed pulsatile tinnitus in one of her ears after an unrelated brain surgery. We're going to hear from you in just a moment. And we are joined virtually from Lavina Cox, who had it in both of her ears. Lavina, good morning.
Good morning.
Thank you for being with us and sharing your story. We'll get with you in just a second. But Dr. Ebersol, I want to start with one very important thing. We go back and forth here inside the studio. Is it tinnitus or tinnitus?
Yes. Importantly, both are equally accepted.
Oh, thank goodness, because I want to say tinnitus. But then I'm told to say tinnitus, so I can say either.
Either one. Perfectly well.
Perfect answer this morning. I like it. So we use that sound of a heartbeat as an example off the top of the program, but technically speaking, the sound is the blood moving through the head. So, Krista, how would you describe that sound? Kind of be really specific, because I'm thinking this would drive me crazy.
So the best way that I learned how to describe it was literally like if you're hearing your heartbeat, first off, but secondly, like imagine when you open a window and you're traveling down the highway at 65 miles an hour and you just have your ear out the window, but it's just spurts of it. It's not constant whooshing, it's just little bits. That's all that you hear.
All the time?
All the time. And it gets worse if your heartbeat goes up.
Okay, so Lavina, would you describe that in a similar way? How did it sound to you?
Mine was a little bit different. A lot of people say they hear that swooshing sound. Mine was more of a squealing. It was a little bit higher pitched than just a swooshing sound. So it was like a squelch to me. Mine was a little bit higher pitched, and I had it in both ears.
Gosh, both sound like maddening, as we said. When did you first notice this? Any clue to what might have triggered it?
I noticed I had it about a year ago, May. I have no idea what triggered it. I'd had some dental work, but that's the only thing I could think of, and really no reason why that would have triggered it. We couldn't, I talked to several PCPs. Have no idea. It just started one day, and I have no idea.
Yeah, unimaginable. You're just living life, and all of a sudden this thing comes out of nowhere. You're trying to figure out what is going on. So give us some examples of how this was affecting your day-to-day life. Was it family, work? How was this impacting you?
It was maddening. It was absolutely maddening. If you can imagine, 24/7, never went away, never stopped. Nothing I did made any difference. Sleep, I have a CPAP, didn't affect it. I could hear it through the CPAP. Didn't sleep well, was unable to concentrate. I mean, you'd be doing reports and all you would hear is this heartbeat all the time, this maddening noise all the time. Difficulty concentrating. It just affected everything you did all day long, 24/7.
So how long did this go on and on until you reached out to someone? Or were you doing some Google searching? How were you trying to find answers?
Well, I work in healthcare, so I reached out to multiple primary care providers, and it's one of those things where tinnitus is just one of those things they say you have to live with. And then I made an appointment with an ENT that I was familiar with, got in to see him. It took me about 6 months. Everything checked out. He sent me for an MRI to see if there was anything going on. That's how I got to KU. So it was a long process to even get to KU to figure out what was going on and what was causing the issue.
But you kept your search up. So
I did.
Chris,
I was not going to give up.
I don't think you could. I mean, that's just going on and on and on. I mean, you gotta keep going until you find an answer. And Krista, in your case, you had mentioned you had an unrelated brain surgery. So what was that surgery, and did you notice it after you had the surgery?
So I had a pituitary adenoma, and it had to be removed, which was causing like Cushing's disease. And I noticed it the November of that same year. So I had surgery in May, and I noticed it in November. And then it took pretty much a year to get it diagnosed. Luckily, I was like already in the system as far as KU hospital, and so there wasn't as hard of a process because I could go reach out to my brain surgeon. I could reach out to the ENT that I was already in contact with, but there was still quite a bit of testing, quite a bit of diagnosing that I still had to go through to make sure that, you know, it was the tinnitus. And yeah, it was still a process. So
you're an electrician's apprentice. You shared some example of your handiwork, and we have to say, very good cable management. This puts a smile on the face of our technical crew in the back here. They like a very organized set of wires there. So, Krista, how did this affect your job?
So I have a very, very like intensive, physically demanding job, whether it's lifting conduit, whether it's pulling wire, you know, like whatever that case might be. And the panel work that you guys were shown, you know, you're trying to focus on something that is so particular, and you need to be very careful, and, you know, you just have this in your ear all the time.
And you can't focus on anything else. It's you're trying to put it out of your mind. I just, like Dr. Ebersol, I'm like going, I can't even imagine what this would be like. No. How did you two come to find each other? I
think it was, I went to see Dr. Milligan. He was my brain surgery surgeon. And then I went to go see Dr. I can't think of his name right now. He was my ENT doctor at the time, and he was like, I'm not really sure. I'm going to recommend you to Dr. Ebersol because he's a little more like fine-tuned in this type of stuff. And then I think your guys' nurses and stuff had me get all of the hearing testing and stuff like that to further diagnose it before we went and did the like the screening.
Yeah. Lavina, how did you hear about this new procedure that Dr. Ebersol is going to tell us more about here in just a moment?
Funny story. I had went to my ENT, as I told you, here in Oklahoma, and I'm a patient of Dr. Ojo's. And so when my MRI came back, and I had a meningioma, and so I reached out to her and said, hey, I've got this meningioma. I need a neurosurgeon. Who do you recommend? And she said, I think you should see Dr. Camarada. And I said, okay. So she helped me facilitate that. So I went to see him, my husband and I. And while we were in his office, he said, well, although you do have this, that's not what's causing your problem. And he starts texting on his phone. My husband and I looked at each other and were like, that's weird. And he said, I'm going to text my colleague because I think he might be able to help you. And I thought, now, how is that for a doctor? Right now, fixing my problem right here in this exam room. I thought that was the coolest thing I'd ever seen.
It's nice when a really great doctor can speed dial another really great doctor right in front of you. That's
I know. I thought I was a special patient that day.
You are. You certainly are. Dr. Ebersol, so we're talking about ENTs and hearing, but you're a brain surgeon.
True.
So tell us about this treatment. How does this compare to other treatments since it's so new?
Well, like a lot of my practice, it is minimally invasive catheter-based. So we are making manipulations to the blood vessels in a non-surgical way to restore normal blood flow. It is the abnormal blood flow right by the ear that is causing this sensation. And it's a structural change to the blood vessel itself. So once it's there, it will be persistent. There's nothing you can do to make this form of tinnitus go away.
So you brought a slideshow for us because we like pictures to help explain all this intricate work you're doing.
Yeah.
So let's pull those up and you can walk us through so we can see
Okay.
what's happening inside the ear.
All right, so look, this is a face-to-face picture, and at the top of the screen you're seeing that dark gray line. That is contrast in the blood of the vein. It's trying to drain out of the brain into the jugular vein of the neck in the direction of that blue arrow there. It gets importantly narrowed at the level of that red line so that the contrast, the blood, cannot flow out. And you can see how close that area is to the inner ear. It vibrates the ear structures, and that's where the sensation comes from. Next slide. So if you put a stent, a metal tube that opens the vessel in the region of the narrowing, you can restore the caliber. Next slide. Oh.
You got another slide, guys? There we go.
So we used to have this obstruction here. Next slide. And now you see the contrast flowing out completely in the direction of the arrow out of the neck, no longer vibrating on the ear. It can relieve the sensation immediately.
And done. One and done? Now,
It
does
can
somebody
be one and done, yes.
So where does this come from? What is causing pulsatile tinnitus?
That part we don't yet understand. It does seem that the narrowing of this vein is the most common cause. The question is what causes the narrowing of the vein, and that part is not yet understood.
How common is it?
Pulsatile tinnitus is the most uncommon form of tinnitus. Tinnitus otherwise is a very common symptom that most patients experience as an annoyance.
So what is tinnitus just as an annoyance?
Yeah, it is a sensation that you are hearing in your ear and nobody else hears
Like
it.
a ringing?
A ringing is a common description, a buzzing, a whooshing. Pulsatile tinnitus is when those sensations are in time with your heartbeat. That is a different beast.
Drive me nuts just hearing you talk about it. I mean,
Absolutely.
these ladies, I appreciate their, their push to find answers. But tell us more about this treatment and just how it's very new. And how important is it to treating people? And what were the options before this?
Before, we did not know what to do about this problem, and so patients were told to simply deal with it. And they would try all types of interventions that you might see on the internet. These things are just not helpful. It is a structural problem of the blood vessel vibrating the structure of the inner ear. So it's been over the past 5 years or so that there's been an accelerating understanding and a real rush over the past, I would say, 12 months to understand that really this is the most causative entity, and you can treat it immediately if you find the right person.
That's exciting for you to
I
do
think so.
something. Yeah, you're going to do something, and then immediately they're feeling
Yes.
feeling good again.
Yes.
So who's a good candidate for this? Anyone with pulsatile tinnitus?
A typical screen that you can do with your primary care doctor is if you have the tinnitus sensation, meaning you're hearing sounds that nobody else can hear, and it's in time with your heartbeat. Simple compression of the neck lightly with your hand can either importantly diminish or completely eradicate the sensation while you're holding the pressure, because you stop the blood flow movement vibrating the ear. If that is the setup for the patient, they are highly likely to have narrowing of that vein and might be a candidate for opening it.
And does this happen over time, this narrowing? Again, I know we don't know a lot about it. Just learning if it's something
Yes.
that...
Well, our best understanding is there's a gradual narrowing process, and then it reaches a critical point that the flow changes. Take, for example, if you have a nice, smooth, meandering river, and then you get a mudslide that cuts off half of the river. Now everything has to gush through this side channel. It's comparable to that.
What was screening like, Krista?
It was pretty simple for the most part, mostly because I was pretty familiar with the actual procedure that he had done, because I had to have him do one for my Cushing's disease, where he was inserting the catheter, up through the bloodstream and stuff, and he was putting dye around the tumor to make sure that it was responding the way it was or wasn't supposed to. And so I was familiar with it, and it was... This one was, I was asleep, right?
I don't remember.
For it.
Could be.
I think I was asleep for the procedure, so I mean, I really didn't feel it anyways. But I mean, it was quick. It was like an hour long for the screening, and then I thought it was the coolest thing ever to see all of the dye move through the blood system, because you don't get to see that normal kind of stuff just day to day. And then he was able to show me right where the blockage was, and I was like, it was my aha moment. Yeah. This makes sense. And I was like, there actually is something wrong.
So, Lavina, how long did it take after the procedure for you to stop hearing the noise?
The first procedure that he did, it was instant. I mean, when I woke up, it was gone. I had vision issues before. They were completely gone. So that was, the first procedure was on the right, and it was the minute I woke up.
So simple recovery, to say?
Yeah. Yeah, I was out of the hospital the next day, came home. It was simple. The second procedure was the same. I mean, it was nothing really.
So here's the part we like to hear: is how is life for you today?
Wonderful, much better. Yeah, I'm back to normal life, more active. You know, my grandkids, loving going and watching them play football, exercising again, enjoying life with my family. It has made a tremendous difference in my everyday life. I'm not exhausted. I'm able to do things that I was able to do before, but just in a lesser capacity because I was so tired all the time.
And you actually had this done during Thanksgiving, I understand. So you were able to celebrate family and listen to them and not that sound in your ear.
Yeah, I had surgery let's see, I had surgery on Tuesday. I left the hospital on Wednesday and cooked Thanksgiving dinner on Thursday.
There you go. I like that. One and done, and you're back to life again. So, Krista, what about you? What is the biggest change for you? You know, we don't really realize how life changes for us until we go through something that's chronic, and then you kind of you've taken it, you know, for granted some of the things that we
and then it's just gone.
That it's gone.
Yes.
So tell us what that was like for you.
So one of the biggest improvements I had was some of the screening that I did prior to going and seeing Dr. Ebersol was a hearing test, and it was in my charts that I was like pretty much going deaf in my left ear because that whooshing sound was so overtaking that I couldn't hear anything. And so it helps a lot because I'm not constantly asking my coworkers, oh, what did you say? I didn't hear you. Or like, it's just, I'm allowed to focus a little bit better. And I had kind of like a short fuse because I would get irritated because I wasn't hearing or I wasn't understanding because it was only coming in through one ear. And so it's just been so nice to be able to like lay down on my pillow and not hear it.
Little simple things in life. I know, Dr. Ebersol, this is a new procedure, but are these stories similar to what you're hearing from patients as far as getting back to those simple things in life?
Absolutely. It is very impressive how predictably it works for the right candidate. You are expecting the patient to have very important response, if not complete resolution, when they wake up from the procedure.
Yeah, a lot of times you have to wait and say, okay, weeks later we'll see, you come back, we'll see how you're doing, your progress, but it's like instant. That's gotta feel good. So if you're watching and you have any questions, send those in. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. We do want to give you an update on this week's COVID count. As of Monday, the health system has 12 active COVID inpatients. Now, none of them are in the ICU or needing a ventilator. This week, however, marks 4 years since the official start of the COVID pandemic. And on tomorrow's episode of Open Mics with Dr. Stites, we are adding a little historical context to COVID-19. We'll see how it compares to other pandemics in the past. Another question for both Krista and Lavina. One study suggested that more than half of the people living with pulsatile tinnitus experience anxiety or depression. Did this impact your mental health?
I think it was a little bit different for me just because I was already on depression medicines coming off of my prior brain surgery just because my hormones were so off. So I didn't personally notice a super huge change, but I also think that it was because I was already medicated for something.
Sure.
So-
Yeah, and we know anxiety and depression, that runs rampant for all sorts of different reasons. So any effects on your mental health, Lavina?
Oh, I think absolutely anxiety would be true with this situation. I don't know how you could not have anxiety with this. It's maddening. This is absolutely maddening to live with.
Yeah, that maddening. That's the word that's kind of the theme that we've used, right?
I want to know, did you ladies think you were going crazy?
Yes.
Interesting. Is that a fair statement somewhat? I mean, again, something you're hearing no one else is. It's hard to describe, Lavina. Is crazy kind of a term to use in a way?
Yeah, absolutely. Absolutely. I mean, you just, I would just go, oh, when is this going to stop? How do I make this go away? I mean, yeah, you just want it to stop.
Yeah, hearing the story, man, that's hard to hear, because I can imagine just not being able to describe it. And there's kind of a theme that we hear from patients on this program, that it's important to be your own advocate, to speak up, ask tough questions, and even switch your doctor if you need to. Lavina, did you run into any situations where someone didn't understand or maybe even dismissed you regarding what you were going through?
Absolutely. I work in healthcare, and people do not understand this particular disease. They don't understand the process. I mean, when you hear the word tinnitus, people think, oh, yeah, you're just going to have to live with that. But, like Dr. Ebersole said, a lot of it's not known. I mean, this is new, but Lord, this is not something you should have to live with.
Yeah, I would imagine it's hard, Dr. Ebersole, because when it's something you can see, but when it's just something you're having to kind of describe, it's different when you go in and somebody could take an X-ray or an image, but it's tough for people like this. What advice do you have for people, going out to other hospitals and other places and trying to describe it and trying to make sure they're getting the help that they need and get to a procedure like this?
Right. Well, I think that was part of the reason I wanted these ladies to come on, so that we can get the news out. I mean, these are sophisticated ladies who were already plugged into knowing how to navigate the healthcare system, and it still took an important amount of time for the diagnosis to be made and a direction to be defined. So, as we talk about on the show, you have got to advocate for yourself. If something is not right about your health, keep seeking the answer. We pride ourselves here at KU of having specialists in every nook and cranny. But you got to get connected with these folks. And it doesn't happen passively. If there's something that's important about your health, advocate.
All right, let's get to some questions from our viewers this morning. And this is a good one. Yen Liang wants to know, would patients with pulsatile tinnitus have a higher risk of getting a stroke? We think blockage in the brain?
Right. Importantly, this is not a blockage. It is a narrowing. It's long-standing. And so it's thought to be a benign condition. You can see the similar narrowing in veins of patients that have no symptoms whatsoever. What is it about that subset that has the narrowing and then gets this importantly debilitating, persistent symptom? We don't yet understand that completely.
So is the tinnitus like a signal that something's narrowing? Is it basically your body kind of, I keep thinking it's a condition, but it's also telling you there's something narrowing.
If you have the pulsatile form, it should definitely be evaluated. It can be related to structural abnormalities, which in this setting, it's benign in terms of its impact on your overall health, but it was clearly debilitating to their everyday life. But there are other conditions related to forms of tinnitus that can be directly related to a negative impact on your health.
Will pulsatile tinnitus recur after vascular embolization treatment?
I will say that the therapy is new enough that we don't know for sure the long-term outlook, but we have data about 5 years out at this point that's showing durability of the stenting process.
When someone has this, are they more likely to have vein narrowing in other places?
I suspect that's probably true, but it doesn't manifest as a symptom, and so those things are tend to be not clinically important and not impacting the patient on a daily basis.
Lavina, did the noise impact your balance at all?
No, it didn't impact my balance.
You had mentioned that the PAP machine didn't really cover up anything. Another question was, did either of you ladies try any noise canceling headphones, any, remedies that you were just kind of, grabbing at straws to try to fix at it?
So the thing with noise canceling headphones is it's inner. You can't cover it up. And so you can put it on, but then I just wasn't hearing out of the left ear. So, I mean, you really didn't fix anything.
There's really no covering it up. Lavina, what did you try?
I tried everything. I tried the noise canceling. I tried music. I tried it all. I tried the drops. I tried everything they had out there. It doesn't work. This is not something you can cover up or get rid of on your own.
Well, I want to get our takeaways today, and you just made a really good point. These are two women that know their way around the healthcare system, but it's really important to be your own advocate and keep pushing and asking questions. So, Krista, I'll start with you. What do you want the takeaway to be from this particular conversation and your story?
Kind of like you guys have mentioned, you really, really need to be an advocate for your own health. And, for both of my procedures, I knew inside, even though I couldn't show you that something was wrong, I knew something was wrong. I could describe it and I could tell you about it. And so that's all that I could go off of. And so I had to be connected with the right doctors and to be plugged in with such special doctors at KU. I have had such an amazing experience at KU. I cannot advocate enough for them. It's just, you need to get plugged in.
Well, we're glad you're happy and doing well. Lavina, what's the takeaway from your story?
I would agree with Krista. Just advocate for yourself. Take care of yourself foremost. I agree with her sentiments on KU. I have the A team of doctors at KU. I am so pleased to get care there. I would do this 10 times over. Dr. Eversole is wonderful. He just takes great care in the whole person, and his team did phenomenal job. Don't be afraid of it. You don't have to live with it. Just go talk to these guys. I mean, you can get help. Don't let people lead you in the wrong direction. Advocate for yourself.
And I'm backing up your story. Dr. Eversole, I have him in my phone too, and he is very good at answering all people phone calls, even down here in the media relations. He's very, very helpful and willing to tackle these tough situations. What's the big takeaway? What do you want people to know?
Oh, well, I'm so happy for these ladies that they're living a better life than they were before. I mean, I can see them smiling freely, and that did not happen when I first met them. I mean, you can't smile if you've got this going on the inside. So I am very happy for your ladies' progress. It's a pleasure to work at a place that has the infrastructure and the personnel to do these advanced things. So from our perspective, if you are a patient and you're having symptoms that you need help with, start with your primary doc and start bumping it up the chain. We've got a whole team of doctors here and nurses and specialists that can help you.
If someone's listening to this and they do go to a primary care, what would they tell them? If let's say they're listening to this program, what would they say? Hey, I heard Dr. Eversole talking about this procedure. How do they describe it? How would you describe telling a doctor, hey, I want to know more about that?
Yes, it's called venous sinus stenting. The vein that gets narrowed is a venous sinus, a large outlet vein from the skull draining into the neck. And so we are stenting that sinus open.
All right, thank you. Always great to have you. Ladies, thank you so much for sharing your stories with us today. Glad you're doing better. Thank you to all of our viewers, and we'll see you back here tomorrow at 8. Masks, shutdowns, and a brand new vaccine. To live through COVID was to witness history. But how will history remember the pandemic? I'm Jessica Lovell on the next Open Mics with Dr. Stites. COVID in a historical context. How the world suffered and learned through other pandemics. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.